I am Dr. Rawal, a senior consultant physician, and I welcome you to this video. The fact that you are watching this video, you are probably concerned about your health and the role cholesterol has to play. Well, today's session is on the management of cholesterol. Cholesterol, how much cholesterol is good and how much can be bad? What is cholesterol? What can it do to our body? Well, it is an essential constituent of our body and plays a very important role in the normal functioning of the cells of our body. It helps produce various hormones. It helps produce vitamin D and bile acid, which helps in the digestion of fat. For a normal health, we need cholesterol, and our body needs cholesterol, it makes for it, and the excess comes from the dietary cholesterol. Dietary cholesterol is the one that we take in, the fatty foods, etc., which elevates our cholesterol levels, and this is the dietary part of the cholesterol present in our body. Now, how much is good, we will see in time to come. But cholesterol is a waxy substance which is present in the blood and is bound to lipoproteins. Lipoproteins are lipid core and outer shell formed by the protein part, and is of two types basically. One is LDL, the low density lipoprotein, which is also called bad cholesterol. Now, this bad cholesterol, if it is in excess, it gets deposited in the inner lining of the arteries, that is the blood vessels which carry oxygenated blood to various parts of the body. When it gets deposited in the inner lining of the arteries, the arteries become hard and they become narrowed. This is called formation of a plaque, which causes a stenosis in the artery. This is a bad cholesterol, and excess gets deposited. Now, we have another lipoprotein which is called high density lipoprotein. That also carries cholesterol. But HDL, that is high density lipoprotein, remember H here is for high density, whereas for you to remember, H would be healthy cholesterol. This is called good cholesterol. This also carries cholesterol, and this helps in taking the bad cholesterol out of our body. So the higher the levels of HDL, the better it is for the body. Now, this is about how the cholesterol is carried from one place to another in our body. It goes with circulation. Now, the other lipids are triglycerides, which are carried by very low density lipids. Triglycerides also beyond a limit are bad cholesterol only. Now, how to recognize who will have cholesterol which is good, which is bad? Are there any symptoms, signs, how we can know? Well, there are no signs or symptoms of a high cholesterol. You cannot know by any presentation of the body that your cholesterol would be high. It is only known by doing a test on blood called a lipid profile, which is done on a fasting blood sample, fasting for about 9 to 12 hours. And the lipid profile reports total cholesterol. It should be, the desirable limit is 150. 150 is what we want. 150 to 200 is all right. But beyond 200 is not acceptable. There it becomes the level which will deposit in the arteries. So, desirable limit, the target is to keep it around 150. Another bad cholesterol is LDL. Again, desirable limits are 70 to 80, but up to 100 is the limit till when we don't take any action. Then we have HDL. HDL is a good cholesterol. It is healthy cholesterol. And HDL we want 60 or above, because HDL is the one which has to drive the excess of LDLs out of the body. So HDL 60 or beyond is good. Now, then we have triglycerides. Triglycerides are, we target 150 again. So 150 for triglycerides, 150 for total cholesterol, LDLs 70 to 80, and triglycerides, HDL more than 60. And these are the values which are considered desirable. Now, if you have values beyond this, if you have values much beyond this, then we have to manage the cholesterol here. That is where it becomes bad. Within that, it is desired by the body, it is required by the body, it is required for the normal functioning of the body, it is required for the various hormones, vitamin D, for bile acid production. But beyond these limits, it becomes dangerous for us. It becomes bad. So we always say these are the desirable limits, but too much or in excess, it is bad. Bad for the heart, bad for the arteries. Now, how to manage these steroid, the lipids, how to manage these lipids when they are beyond a desirable limit. Statins are the, first comes the lifestyle management. Lifestyle management would be that you take precautions as far as the dietary intake is concerned. Dietary intake means you do not take fatty meat, you do not take dairy products. Dairy products would mean butter, milk which from where the fat has not been removed. So these products one has to avoid. Now, what is suggested in diet is lean meat. Lean meat is the chicken and seafood, the fish, etc. Skimmed milk, the milk from where the fats have been removed. The fruits and vegetables in excess would constitute a healthy diet, will constitute a diet which is very, very low in cholesterols, and that comes first. Then comes physical activity. Now, lifestyle management comes first and foremost, and patients in whom the cholesterol levels are just out of the desired limit, we just give them a trial of lifestyle management so that we can just manage about 15 to 20% of the cholesterol levels, and medicines may not be required. Now, physical activity is again very important. Physical activity would mean brisk walking, cycling, and some yoga exercises. These are required to bring your LDL levels low, and this definitely does help. Now, how much of exercise, how much of walking is required? We normally recommend 30 minutes every day, at least 6 days in a week, or even if you are managing 150 minutes in a week is good enough. So, physical activity is very important. Then next comes, you have to be careful, quit smoking. Quit smoking is very important. And how smoking helps is, how quitting the smoking part will help. Smoking actually reduces the HDL, which is good cholesterol. So indirectly, it becomes bad because your HDL is going down. HDL, which is good, which has to remove bad cholesterol from the body, it goes down. Once it goes down, then it becomes bad for your heart. So smoking has to be stopped by all means, and that is why on the pack of cigarettes, if you look at a pack of cigarettes, it is written there, injurious and dangerous to health, and it's written there, it kills. So one has to be very careful. Smoking has to be stopped by all means. Then comes stress management, how to manage your stress. It is very important. So the stress can be managed by doing some meditation, and if meditation is not helping, and if the stress gets too much, then some medications are there. Then comes good and comfortable sleep. Sleep should be sleep which is good for your health should be 7 hours in a day. 7 hours of uninterrupted sleep in a day. Now, this is about lifestyle management. Then we will also talk about the medicines. Medicines normally, when the cholesterol, the bad cholesterol is way beyond the desirable limits. Now, medicines are statins. Statins are like atorvastatin or rosuvastatin, commonly rosuvastatin and atorvastatin, and they help bring down the bad cholesterol. Then the next group of medication is the nicotinic acid. Nicotinic acid is the one which helps bring down the LDL, but basically it brings the good cholesterol, that is HDL, it raises the HDL. So indirectly it reduces the LDL, because once the HDL goes high, the LDLs would be removed from the body by HDL. So nicotinic acid is basically to enhance or to raise the good cholesterol in the body. Then come the group of medicines called the fibric acids or the fenofibrate, which is to bring down the triglycerides. And also, else than bringing down the triglycerides, it also helps reduce LDL to some extent. And then come the cholesterol absorption inhibitors, which can be given in addition to the statins, or they can be given alone, like ezetimibe is the drug. They help slow down the absorption of the cholesterol, or basically they inhibit cholesterol absorption from the enterocytes of the gut. So this is about how to manage cholesterol by lifestyle management and by medication. Now what are the myths attached to these lipids? There are certain myths. We normally in our country we get to hear lot many times, cholesterol. Now, if a patient is taking cholesterol, he thinks that his lifestyle management not required, his dietary precautions are not required. No. You may be on medicines, but these things, lifestyle management and your dietary restrictions of cholesterol and lipids, is as important as ever. So, another myth is that if you are taking medicines, you need not reduce your weight. It is required. You have to do every effort to manage your cholesterol, and lifestyle changes have a lot role to play in that. Now some people think that children cannot have it. And this is a disease concerned with the adults, and children cannot have it. Families where high lipids or dyslipidemias happen in the families, the children ideally should be tested after 9 years of age, and if found erratic, high cholesterols, high lipids, then they should be managed in children of that age also, whenever it manifests in children as well. Now, this is in children, it is called familial hypercholesterolemia. Now, familial hypercholesterolemia should be managed at that stage, which is not being practiced here in our country. So, another myth is that it is a disease of males. No, it happens to females also, and as much to females, although the incidence of heart problems is low in females, but it does happen to females also. So these are the myths. One should be very clear about them, and take care of your cholesterols, take care of your health, stay healthy and stay happy is my message to you. Thank you very much for patient listening to this video. Thank you.